Silikali ya Kaunti ya Masaku Niyatula Muti, Minista wa Uthukumi Dr. Alfred Mutua kwa Kutambuka Sivitali ya Machakos level 5 Atambite kukwithiwa na Uneenan'ya na Ngavana wa OU Wavinya Ndeti. Minista Muviani wa Uiiti Kauntini ya Masaku Justus Kasivu Easya Itambya ya Mutua ni ya Kuvuthiisya Ngwatanio wa Silikali Nene na ila ya Kaunti aikulya bethiwe ndai ya Uneenan'ya na kuatiwa kwa mitalatala ila yethitwe ikitupo ayazi Silikali ya Wavinya yethi ya Uthukumi mubaluku kuma kwa Ngavana wa Veta na Dr. Alfred Mutua na yu Niwailitye Uthukumi Muviani wa Uiiti.
Yesterday, the Cabinet Secretary for Labour, Dr. Alfred Mutua, visited our county referral hospital, among other areas, without according the county government the requisite courtesy of paying a courtesy call on Her Excellency the Governor, as would ordinarily be expected when a senior national government official visits any county. While we welcome and appreciate visits by the national government officials to Machakos, such engagements should be undertaken in accordance with established intergovernmental protocols and with due respect for the office of the governor and the structures of the county government. We also have intel that the former governor is planning tours around the county, especially within those facilities, with an aim of tarnishing the progress made by the current administration. Just to bring up to speed, a number of health projects were left stalled by the former governor's administration, and which the current governor, Her Excellency Wavinya Ndeti, has been reviving over the last 4 years. This includes incomplete health facilities, promotion backlogs, some spanning more than 10 years for our officers, huge pending bills with KEMSA and other suppliers, dilapidated medical equipment, among others. Machakos County has transformed health sector. As the current Cabinet Secretary for Labour, we call upon Dr. Alfred Mutua to stop politicizing health services in Machakos County and first work on addressing the ongoing national industrial action by nurses and clinical officers. I'll take this opportunity to present the key achievements of the Machakos County Department of Health over the last 4 years. Over this period, we have made significant and measurable strides in transforming the health sector, improving access to quality healthcare, strengthening our health workforce, expanding infrastructure, modernizing our facilities, and enhancing accountability efficiency in the management of health resources. These achievements reflect our commitment to building a stronger, more responsive and people-centered health system, while ensuring that the people of Machakos can access quality healthcare as close to home as possible. Governor Wavinya administration has undertaken an unprecedented expansion of health infrastructure across Machakos County. We have constructed 26 new health facilities across Machakos County and upgraded 49 existing facilities, bringing quality healthcare services closer to our people and improving the environment in which healthcare is delivered. Access to medicine is one of the most important measures of a functioning health system. The current administration has therefore significantly increased investment in medicines and medical supplies. In the financial year when Governor Wavinya took power, which is 2022-2023, the annual procurement budget for medicine stood at approximately Kenya shillings 128 million. Today, this collection has increased to over 290 million per year.